My name is Junior Blair, and I'm a social worker, also a HIV cancer tester, and I'm attached to FACT NGO. Well, the HIV coordinator basically coordinates HIV activities that gives to HIV testing and person knowing the status. He was HIV positive at the time, and he felt like committing suicide, regardless of the help he would have received from his family. But I was able to convince him to actually say, you know, yes to life and no to suicide. Sometimes you go into homes and the surrounding environment is not as best kept as it should be, but at the same time, you don't want to show the client that, okay, you're not that comfortable, but at the same time, you could prevent yourself, like for instance, walking with hand sanitizer and these type of things. Just pour a little on your hand, so that at the same time, you don't transfer the bacteria. So there's to be some concern at times in terms of having kids because person will show up to do tests, and once you don't have kids, you got to turn them back, or you refer them to other organizations to have the tests. Because sometimes persons come at the time when they actually make up their mind to say, well, hey, I'm ready to have a test, and then there's a time that you don't have test kits. It's the decline of funding and the transitioning of clients. One of my close relatives, is HIV positive, and the way how we relate to each other, it's amazing. And somewhat, I would like to think that I may have contributed to the positiveness in the person becoming, like full of life and full of energy because we share a lot, we talk a lot. I ensure that the person actually have regular checkups and adherence to clinic appointments and these type of things. So we form a good bond. And in the outer realm, in terms of persons who are not really close to me, by being around in the community, I would have been able to facilitate, especially in the lives of people and the family, that HIV is not a death sentence. There are things more worse than HIV. And I was giving them the example of if you had to choose between HIV, cancer, and diabetes, which one you choose? And after carefully considering it, most of them would say, they prefer the HIV because there's treatment for it. Because with the cancer, if the doctor told you that you'll die in 5 months, best believe it is 5 months you have to live. If the doctor realized that his sugar is in your foot to your hip, and you got to amputate the foot, that's it. HIV, nothing like that is occurring. It's up to you, and you making your own judgment as to say, well, hey, I'm ready to take my medication, or you don't want to take your medication.